Diabetic retinopathy. Here's what it is, how it's managed, and how it might come up in an OSCE station. So there are 3 stages. First is called background retinopathy. This is the early stage. You might see small changes at the retina like microaneurysms, dot and blot hemorrhages, hard exudates, and cotton wool spots. Most people won't notice any symptoms, and it's usually picked up during a routine exam. The next stage is pre-proliferative retinopathy. This is when the damage is starting to progress. As well as the background signs, you might also see vessel changes like venous beading and IRMA, which stands for intraretinal microvascular abnormalities. These are signs that the retina isn't getting enough oxygen and it's preparing to grow new blood vessels. Then we get to proliferative retinopathy. At this point, the retina starts to grow the new blood vessels. These new blood vessels are fragile and abnormal and can lead to long-term damage and sight loss. If any of these changes are close to the macula, it's called maculopathy, and again, it's quite sight-threatening. Now, in terms of management, the most important thing is good control of your blood sugar, blood pressure, and even cholesterol. That's the foundation. If the condition progresses, there are treatment options like laser therapy, called panretinal photocoagulation, or even anti-VEGF injections, which can help stop those abnormal vessels from growing. Now, if you're a student preparing for OSCEs or even working in a clinic, explaining this clearly to a patient is key. A common OSCE station is breaking down diabetic findings and explaining your management plan. So if that came up, a layman explanation might go something like this. So we've seen some early changes that diabetes is starting to affect the back of your eyes. It's quite common, especially if your blood sugar's been running high a bit recently. At this stage, it's nothing to worry about and your vision's likely to be absolutely fine, but if left unmanaged, it can slowly progress over time. Something we like to do is send a letter to your GP to get you enrolled in the diabetic eye screening programme. That just means we'll take regular photos of the back of your eye to keep an eye on things. It's a routine part of the diabetic care and helps us catch any changes early before they become a problem. Does that sound okay to you? So that's diabetic retinopathy explained. Drop a follow for more optometry content and drop any questions or requests below.